Good morning, my name is Ronnie Scott and we'll be doing our presentation this morning on Medicare. This will be part of our social work gerontology class. We're part of the O and D group, which consists of Maya, Kiana, Darren, and Sanalis. What we're going to be covering today in our presentation is what is Medicare, the purpose of Medicare, the history of Medicare, and the significant impact it has made as it relates to our current time. So without any further delay, we're going to get started with what is Medicare.
What is Medicare? Medicare is a federal system of health insurance for people over 65 years of age and for certain younger people with disabilities. This is a federal system where all the government pays for portions of your Medicare Advantage premiums, co-payments, and deductibles. Most people generally consider this to be a Medicare subsidy, even if the payment is for a Medicare Advantage plan instead of the original Medicare plan.
The purpose of Medicare was designed to assist the nation's elderly in meeting hospital, medical, or other health costs. Medicare is available to most individuals 65 years of age and older, or individuals that are disabled. In some ways more than others, it can be looked at as an added subsidiary for retirement. You can qualify for Medicare if you are 1, a U.S. citizen or a permanent legal resident who has lived in the United States for at least 5 years. 2, if you are receiving Social Security or railroad retirement benefits or have worked long enough to be eligible for those benefits but are not yet collecting them. 3, if you or your spouse is a government employee or retiree who has not paid Social Security but has paid Medicare payroll taxes while working. If you are under the age of 65, you may still be eligible if you have If you have been entitled to Social Security benefits for at least 24 months, but not consecutive. 2, you receive disability pension from the Railroad Retirement Board and meet certain conditions. Or 3, if you have Lou Gehrig's disease, also known as amyotrophic lateral sclerosis, also known as ALS, which qualifies you immediately. Or if you have permanent kidney failure, requiring regular dialysis or kidney transplant, and you and your spouse have...
Some of the benefits of Medicare include annual checkups with doctors that take Medicare. These checkups come with wellness with mammograms. Some physicals have copay, which are around $10. For individuals with medical conditions, checkups are every 6 months. The way Medicare is set up is the government's paying portion of it and is usually split 80-20. They pay 80% of everything and you have to pay 20% even if you do not have supplementary insurance like a Senior Care Plus.
Why is it needed? Medicare is a medical benefit. Medicare delivers a guaranteed level of coverage to people who might not otherwise be able to afford it. Furthermore, it helps insulate beneficiaries from rising healthcare costs. People who are enrolled in the program may still pay thousands of dollars a year for healthcare, but their access to healthcare is vastly better than before the existing program.
The history of Medicare. Over its 30 years of operation, Medicare has provided elderly Americans, and especially poor elderly Americans, with the opportunity to benefit from the many advances of American medical technology, most notable treatment for heart disease, cataract surgery, and to gain improved access to healthcare system. Low-income elderly people have been particularly relying on Medicare coverage because they are in poorer health than high-income elderly and therefore are more likely to use health services. Although Medicare provides basic health insurance to promote access to care, it is not all-inclusive, comprehensive, and free medical plan for the elderly poor and near poor. Healthcare in America is different now than when President Lyndon B. Johnson signed the Medicare and Medicaid into law on July 30, 1965. Since that time, the government has poured billions into healthcare each year. That has led to better care, but also resulted in the need for constant reevaluation so the government can ensure people continue to get coverage. Medicare have aimed to reduce barriers to medical care for America's most vulnerable citizens, aging adults, and people living in poverty. They removed the racial segregation practiced by hospitals and other healthcare facilities, and in many ways they help deliver better healthcare. By ensuring access to care, Medicare has contributed to a life.
In 1965, Medicare created to provide health insurance for seniors in the U.S. beginning in 1966, signed by President Johnson. In 1966, Medicare coverage began for people over the age 65 and over. Coverage began for seniors who signed up for the voluntary medical insurance program. About 19 million individuals enrolled in Medicare about this time. On October 30th, 1972, President Nixon signed the SS Amendments of 1972. It became extended to individuals under 65 and long-term disabilities who are receiving the SSDI payments for 2 years and people with end-stage renal disease. Medicare benefits were extended to include some chiropractic services, speech therapy, and physical therapy.
In summary, we have highlighted what is Medicare, the purpose of Medicare, the history and where it derived from. We also covered the benefits of Medicare, and we shared how Medicare has impacted today's society. From the O and D group, this concludes our presentation.